Look down at your hands right now. The secret warnings about your health are hiding in plain sight. Doctors are discovering that your hands might be sending urgent signals about serious conditions developing inside your body, conditions you won't feel until it's much harder to treat. And the most alarming sign? Most people mistake it for normal aging when it's actually something far more concerning. Your hands are remarkable health monitors that most people completely ignore. They contain intricate networks of blood vessels, nerves, and connective tissues that reflect what's happening throughout your entire body. Yet we rarely examine them beyond noticing a cut or bruise. What medical researchers have discovered in recent years is that subtle changes in your hands often precede diagnosis of serious conditions by months or even years. These early warning signs aren't being taught to patients, leaving millions unaware that the solution to mysteriously declining health might be literally at their fingertips. The healthcare system typically waits until symptoms become severe before investigating, but by then conditions have often progressed significantly. Understanding what your hands are trying to tell you could lead to earlier intervention when treatments are most effective. Today, we'll examine 5 critical hand signals that shouldn't be ignored, especially after age 50. These aren't rare occurrences. They affect millions annually, yet continue being dismissed as just part of getting older. Let's look closely at what your hands might be revealing about your health right now. Nail changes are perhaps the most overlooked health indicators. Most people think of nails as merely cosmetic, but they're actually windows into your circulatory and respiratory systems. A particularly concerning sign is nail clubbing, when fingertips enlarge and nails curve downward over the tips. This dramatic change happens when tissues beneath the nail beds receive insufficient oxygen over extended periods. Research from Oxford University found that this distinct change can precede diagnosis of serious lung conditions by an average of 18 months. What makes this warning sign especially dangerous is how gradually it develops. The changes occur so slowly that most people never notice them happening. Even more troubling, when people do notice, they frequently attribute the changes to normal aging rather than a potential medical emergency. Nail ridges tell another important story. While some vertical ridging is normal with age, sudden appearance of horizontal ridges, sometimes called Bowes lines, can indicate periods of severe physiological stress. These ridges form when nail growth temporarily slows or stops due to illness, nutritional deficiencies, or medication reactions. Don't dismiss changes in nail appearance as cosmetic concerns. When nail beds turn pale, develop unusual coloration, or change shape, your body is sending signals about deeper issues that deserve professional evaluation. But nail changes are just the beginning, because the next warning sign affects millions, yet remains largely unrecognized until it becomes severely debilitating. Hand tremors that come and go might seem like nothing to worry about, but neurologists warn they often represent the earliest detectable signs of several serious conditions. The dangerous misconception is thinking occasional shakiness is simply due to fatigue or stress. What most people don't realize is that intermittent tremors often begin years before other neurological symptoms become apparent. A groundbreaking study from Johns Hopkins found that subtle hand tremors preceded formal diagnosis of neurological conditions by an average of 4 years in 62% of patients studied. These tremors are particularly deceptive because they often disappear with concentration, leading people to believe they're merely imagining the symptoms or that they're insignificant. Even more concerning, family members rarely notice these early tremors, leaving individuals without the external validation that might prompt them to seek evaluation. Pay attention to subtle shakiness when holding a cup, writing, or performing detailed tasks. If you notice intermittent tremors, document when they occur and under what circumstances. This information could provide crucial insights for earlier diagnosis of conditions that respond best to early intervention. The pattern and timing of tremors tells medical specialists important information about your nervous system. Essential tremors typically occur during action, while resting tremors might indicate other conditions. Rather than hiding these symptoms or working around them, consider them important messages from your nervous system that deserve professional interpretation. While tremors might be concerning, they pale in comparison to our next sign, because this one silently affects your entire cardiovascular system, while presenting as something completely unrelated to heart health. Changes in hand color and temperature represent critical warnings about your circulation that most people completely miss. The dangerous assumption is that cold, discolored fingers are simply a normal response to cooler environments. When hands frequently turn white, blue, or deep red, especially in response to emotional stress or temperature changes, it often indicates circulatory problems that may affect your entire vascular system. Research from the Mayo Clinic found that these color changes can precede diagnosis of various autoimmune and cardiovascular conditions by an average of 7 years. What makes this particularly troubling is how easily these episodes are dismissed. People often joke about having bad circulation without realizing this isn't normal. It's a warning. Even more concerning, these color changes can indicate conditions that dramatically increase risk of more serious cardiovascular events. Raynaud's phenomenon, where fingers turn white then blue before becoming red upon rewarming, affects an estimated 5–10% of Americans. While sometimes occurring independently, it's frequently associated with underlying conditions affecting connective tissue or blood vessels throughout the body. Yet most people experiencing these dramatic color changes never mention them to healthcare providers. Instead of accepting color changes as a quirk or minor inconvenience, document their frequency and triggers. Photographs during episodes can be invaluable diagnostic tools. These simple steps could lead to earlier detection of conditions, signs, affecting your entire circulatory system. But circulation problems are just part of the story, because our next sign might be revealing critical information about your hormonal and metabolic health. Swelling and stiffness in the hands are frequently misattributed to aging or overuse, but endocrinologists warn these changes often signal serious hormonal imbalances. The common mistake is assuming that puffy or stiff hands are simply part of getting older. When hands become consistently swollen, especially in the morning, it might indicate thyroid dysfunction, which affects virtually every system in your body. Research published in the Journal of Clinical Endocrinology found that 74% of patients later diagnosed with hypothyroidism reported hand swelling and stiffness as their earliest symptom. Yet fewer than 12% mentioned these changes to their doctors. What makes this particularly concerning is how these symptoms are often attributed to arthritis without proper testing. The difference matters enormously, as untreated thyroid conditions can lead to serious cardiovascular complications, cognitive decline, and metabolic disorders that affect your entire body. Pay attention to how your rings fit throughout the day and whether hand stiffness improves or worsens with activity. True inflammatory conditions typically worsen with use, while metabolic causes often follow different patterns. These distinctions provide crucial diagnostic clues for healthcare providers. The connection between hand symptoms and hormonal health extends beyond the thyroid. Certain patterns of swelling can indicate liver dysfunction, kidney problems, or even cardiac insufficiency. Rather than accepting these changes as inevitable, consider them important indicators that your endocrine system needs attention. But swelling patterns are just one piece of the puzzle, because our final sign might be revealing critical information about your neurological health that even many doctors overlook. Changes in hand strength and coordination represent some of the earliest detectable signs of neurological conditions, yet they're frequently attributed to normal aging. The dangerous misconception is thinking that dropping items or struggling with buttons is simply part of getting older. What neurologists have discovered is that subtle changes in dexterity often appear years before other, more recognizable symptoms of nervous system disorders. Research from Northwestern University's Feinberg School of Medicine found that declining hand strength preceded other symptoms of neurological conditions by an average of 7 years in their study population. What makes this particularly troubling is how people adapt rather than investigate. Instead of questioning why buttons suddenly become difficult to fasten, most people simply switch to different clothing styles. Rather than investigating why handwriting has changed, they type more often. These adaptations mask important warning signs that could lead to earlier intervention. Pay attention to changes in your ability to perform fine motor tasks that were previously automatic. If you notice yourself avoiding certain activities because they've become frustratingly difficult, consider whether this represents an important change rather than a normal limitation. Simple tests like timing, how long it takes to pick up small objects, watching for changes in handwriting, or measuring grip strength can provide objective measurements over time. These observations could lead to earlier detection of conditions that respond best to prompt treatment. Your hands aren't just tools for interacting with the world. They're sophisticated monitoring systems, constantly providing feedback about your internal health. The 5 signs we've discussed, nail changes, tremors, color variations, swelling patterns, and coordination changes, offer invaluable insights that shouldn't be ignored. The body provides warnings before major health events, but these signals are often subtle and easily dismissed. By paying attention to these specific changes in your hands, you take control of your health rather than leaving it to chance. Remember that aging brings changes, but not all changes represent normal aging. The difference is knowing which symptoms warrant attention and which can wait. When these particular warning signs appear, treating them as normal aging could mean missing critical opportunities for early intervention. Now that you understand what your hands might be revealing, will you continue ignoring these subtle changes? Or will you become your own best health advocate? The decision you make after watching this video could dramatically impact your quality of life for years to come. Look down at your hands again.